Did you know that an iron deficiency is the most common nutritional disorder in the world? Your body needs a sufficient source of iron to produce hemoglobin, the blood component responsible for transporting oxygen to different parts of the body. A severe iron deficiency is a condition called anemia. In today's video, we will tell you 10 signs and symptoms of iron deficiency like fatigue, hair loss, and shortness of breath. Let's begin. Number 10. Hair loss. Iron deficiency, especially when it develops into anemia, can cause hair loss. When hair follicles don't get enough oxygen, they go into a resting stage, where the hair falls out and doesn't grow back until the anemia improves. It is normal to lose about 100 strands of hair per day. However, if you notice your hair loss is excessive and is not growing back, this may be a sign of an iron deficiency. Number 9. Shortness of breath. Hemoglobin is responsible for carrying oxygen in red blood cells, and when hemoglobin levels are low due to iron deficiency, the body's oxygen levels will also be low. This can result in a shortage of oxygen in the muscles, leading to increased breathing rate and shortness of breath as the body tries to compensate. Shortness of breath during normal, daily activities such as walking, climbing stairs, or working out could be a symptom of iron deficiency. Number 8. Fatigue. If you feel exhausted all the time, even after proper rest, it may be a sign that you are anemic. This is the most common symptom of iron deficiency, but can also be easily overlooked due to our busy lifestyles and normal feelings of tiredness. Iron deficiency reduces the amount of oxygen reaching the tissues, causing a lack of energy. This can lead to feelings of weakness, irritability, and difficulty concentrating. People with advanced iron deficiency, resulting in anemia, are often referred to as having tired blood. Number 7. Heavy periods. In women, heavy menstrual bleeding is the leading cause of iron deficiency. The loss of blood and insufficient replacement of iron can result in a cycle of iron loss and deficiency with every new period cycle. A heavy menstrual cycle typically results in a loss of 2 to 3 tablespoons of blood per month. If a woman has to change her tampon more frequently than 2 hours, it could indicate excessive blood loss, and they should visit a gynecologist. Number 6. Frequent infections. Iron plays a key role in a healthy immune system, and lower levels of the mineral can increase susceptibility to infections. Red blood cells help transport oxygen to the spleen, an important part of the immune system that requires oxygen to fight off infections. Without enough oxygen, the spleen is not able to function properly. Red blood cells also carry oxygen to the lymph nodes, which house infection-fighting white blood cells. When you have an iron deficiency, your white blood cells won't produce as they should. Without adequate oxygen, the individual is more vulnerable to infection. Number 5. Restless Leg Syndrome. Iron deficiency has been linked to restless leg syndrome, especially when it progresses to anemia. Restless leg syndrome, or RLS, is characterized by a strong urge to move your legs, usually accompanied by unpleasant sensations like crawling, itching, or tingling. It is usually worse at night, interfering with sleep. The causes of restless leg syndrome are not fully understood. However, up to 25% of people with RLS are thought to have iron deficiency anemia, and in these cases, the severity of RLS may be related to the severity of the anemia. Number 4. Heart palpitations. Noticeable heartbeats, also known as heart palpitations, can be another symptom of iron deficiency anemia. Hemoglobin is the protein in red blood cells that helps transport oxygen around your body. In iron deficiency, low levels of hemoglobin mean that your heart has to work extra hard to carry oxygen. This can lead to irregular heartbeats or the feeling that your heart is beating abnormally fast. In rare cases, severe and prolonged iron deficiency can lead to an enlarged heart, heart murmur, or even heart failure. However, these symptoms tend to be a lot less common. Number 3. Pale skin. Pale skin and pale coloring of the inside of the lower eyelids is another common sign of iron deficiency. This can also affect other areas of the body like the face, gums, inside of the lips, and nails. Hemoglobin gives blood its red color, so low levels during iron deficiency results in less red blood, causing the skin to lose its healthy rosy color. This is often one of the first things doctors will look for as a sign of iron deficiency. Paleness is more commonly seen in moderate or severe cases of anemia. Number 2. Cold hands and feet. Iron deficiency anemia can result in reduced oxygenation of the blood, which can cause decreased blood flow to the extremities and result in feelings of coldness in the fingers and toes. Cold fingers and toes can also be symptoms of other issues, so be mindful before you conclude you have an iron deficiency. Number 1. Chewing ice. Another odd symptom of an iron deficiency is an intense craving for ice. This condition, called pagophagia, is a form of pica, an eating disorder that causes people to eat substances with no nutritional value. People with pagophagia eat several cups of ice every day. One study suggests that eating ice may give a boost of energy to those suffering from an iron deficiency. What really causes iron deficiency? Blood loss. Iron is primarily stored in red blood cells and is essential for the formation of hemoglobin, which carries oxygen in the blood. An iron deficiency may occur when there is a loss of blood from an injury, giving birth, or heavy menstruation. In some cases, slow loss of blood from chronic diseases or some cancers can also lead to an iron deficiency. Pregnancy. Low iron levels are a common problem for pregnant women. The growing fetus needs a large amount of iron for its development. The increased blood volume in pregnant women also increases the demand for iron, which can lead to an iron deficiency. Pregnant women are typically advised to consume iron-rich foods to ensure adequate iron levels during pregnancy. Decreased ability to absorb iron. In some cases, people may have difficulty absorbing iron from their diet, even if they are consuming enough iron-rich foods. This can be due to conditions that affect the small intestine, such as celiac disease or Crohn's disease, or if a portion of the small intestine has been removed. Poor diet. Diets that lack iron can be a leading cause of iron deficiency. Consuming iron-rich foods such as eggs, meat, poultry, fish, legumes, leafy green vegetables, and fortified grains can help maintain a healthy iron supply and prevent iron deficiency. If an iron deficiency persists and you're including iron-rich foods in your diet, consult a healthcare professional. Can you prevent iron deficiency? Yes, there are certain steps that you can take to prevent iron deficiency from happening. Calcium pills. Calcium can interfere with the iron absorption and make it harder for your body to absorb enough iron. To maintain adequate iron levels while also getting enough calcium, it's important to talk to a doctor. They may recommend things like adjusting the timing of calcium and iron-rich food consumption, taking iron and calcium supplements, or making dietary changes. Treat the cause of blood loss. If you have heavy menstrual periods or digestive system problems, such as frequent diarrhea or blood in your stool, seek treatment. Make healthy food choices. Most people who make healthy, balanced food choices get the iron and vitamins their bodies need from the foods they eat. Avoid drinking coffee or tea with meals, as these drinks make it harder for your body to absorb iron. Eat foods rich in iron. Good sources of iron include lean meat and chicken, dark leafy vegetables, and beans. Eat and drink foods that help your body absorb iron, like orange juice, strawberries, broccoli, or other fruits and vegetables with vitamin C. You can be deficient in something and not even know it. Do you know anyone who is iron deficient? Let us know in the comments below.